So, Dr. Burke, why is it important for clinicians to ask their patients about insomnia, and particularly insomnia in the setting of Alzheimer's dementia?
Well, Alzheimer's dementia is the most common type of dementia. It's about 60 to 80% of all dementias. Alzheimer's disease is a huge problem for our society. We estimate that currently there are about 5 million Americans who are struggling with this disease. Every 66 seconds, somebody is diagnosed with this disorder. And the number of Americans affected by this disease is expected to rise significantly over the next few decades. In fact, we estimate that about 15 million Americans will be affected by Alzheimer's by the year 2050. Even though we really think about this disease as being a memory disorder, a cognitive disorder, it affects so many other aspects of a patient's life. It can affect their behaviors, it can affect their function, and it can affect their sleep. It can cause insomnia and other sleep disturbances. Now, we know that the underlying pathology that occurs in Alzheimer's disease actually occurs about 10 to 20 years before a patient is ever diagnosed. So before they cross our doorsteps complaining of memory problems, those pathological changes like the buildup of amyloid plaque will have been occurring for the past 10 to 20 years. They may also already be showing signs of some of the non-memory aspects of the illness, like for instance, changes in sleep patterns. So identifying changes in sleep patterns early on in somebody who is older and perhaps at risk of developing Alzheimer's disease may give us an opportunity to implement treatments for the disease itself at an earlier stage. We also know that insomnia, inefficiencies in sleep during the course of the illness can affect how quickly cognitive and functional abilities deteriorate. So the worse the sleep, the worse the cognition, the faster the rate of progression. Again, treating these disorders is going to be important in the overall treatment of these patients.
And I absolutely agree. And sometimes having a sleep disorder like RBD, REM sleep behavior disorder, may help pre-classify the underlying dementia in a patient with previously diagnosed Alzheimer's disease into an alpha-synucleinopathy or a different subtype, a different phenotype of insomnia. And this is such an amazing window of opportunity that can help quality of life for the patient and their bed partners and family for the years to come. And this is not an acceptable way in which patients can accept that insomnia is there forever and something they cannot really get a handle on.
And that's an important point. You're treating not just the patient, you're treating the family. The care partner is oftentimes just as affected by the sleep disturbances. And we know that untreated sleep disturbances lead to earlier institutionalization. They can add to caregiver burnout. So other reasons that we should implement treatment early on.